The A1C test, also known as the hemoglobin A1C, HbA1c, glycated hemoglobin or glycosylated hemoglobin test, is a blood test that measures the average blood sugar, glucose, levels over the past 2 to 3 months. It works by measuring the percentage of hemoglobin proteins in red blood cells that are coated with glucose, called glycated hemoglobin. Since red blood cells live about 3 months, the A1C test reflects long-term blood sugar control rather than a single point in time. Purpose of the A1C test: diagnosing diabetes and prediabetes. The A1C test helps diagnose type 2 diabetes and prediabetes by indicating if blood sugar levels have been consistently high. Monitoring diabetes management. For people with diabetes, the A1C test shows how well blood sugar has been controlled over the past few months and helps guide treatment plans. Assessing risk. A higher A1C level indicates poorer blood sugar management and a higher risk of diabetes-related health complications, such as heart disease, kidney disease, and nerve damage. How the test is done. Blood is drawn either from a vein or by a finger prick. No fasting is required before the test. The result is reported as a percentage, representing the proportion of hemoglobin that is glycated. Interpretation of results. Normal A1C level is below 5.7%. Prediabetes is indicated by an A1C level between 5.7% and 6.4%. Diabetes is diagnosed with an A1C level of 6.5% or higher. For people with diabetes, treatment goals vary but generally aim to keep A1C levels below 7% to reduce complications. Summary: the A1C test is a simple, reliable blood test that provides an average measure of blood glucose control over the previous 2 to 3 months. It is essential for diagnosing diabetes and prediabetes, monitoring ongoing diabetes management, and assessing risk for diabetes complications. This test offers a broader picture of blood sugar levels than daily glucose monitoring and is a key tool in diabetes care. Follow Dr. Vegapunk more about human body.